Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone, and welcome to another episode of the Dental Brief. Today we have with us a very special guest who works all over this planet, but is coming to us from Toronto and beautiful Ontario, Canada. Lisa Philp, say hello.
Hello, everybody. Pleasure to be here.
So, yeah, it's wonderful to have you here. Let's talk a little bit about your background. How did you get into dentistry?
Well, 3 decades ago, I decided through some emphasis from my father to become a dental hygienist. So I went to East Tennessee State University, graduated as a dental hygienist, and worked for 10 or 11 years in East Tennessee, and then moved back up north of the border to Canada, and transitioned into doing hygiene programs, consulting, and then evolving into an entrepreneur and coach.
Yeah. So what made you make that leap? What made you decide to make that leap from actually working in practices to saying, hey, I want to help other dentists with what I've learned and what I know?
I think the big part was, as much as I love dental hygiene, the part I liked about dental hygiene was the people part of it, as opposed to the technical part of it. So I think a lot of external influence from people encouraging me to look at a career in duplicating some programs that I had implemented in a very large dental practice. And then being the right 80% of life is timing, the right place at the right time. I had someone formally approach me and ask me to implement perio programs across Canada. And so I slowly transitioned out of hygiene and got through the shock of going home and letting my family know that I'm going from a steady 4-day-a-week, 30 hours of a very well compensated position to eat what you kill entrepreneur. And it was I guess people would call me a bit of a risk taker, but
Sure.
I take calculated chances, and it was something that really, when I started getting into it, matched my strengths, my passion, and I'm here still 27 years later, helping all kinds of different dental practices.
That's awesome. So fast forward, here we are, right? 2021. It's right now we're recording this, probably won't air for another month or so. It's almost June 1st. It's the 28th of May. And you are the Chief Visionary Officer at the Transitions Group.
Yes.
So you talk to dentists all the time. You talk to office managers all the time. You talk to hygienists all the time. Tell me, what is going on in practices? What are you hearing, and what types of problems are you helping dentists solve right now?
Well, I mean, it's an interesting time to ask this question because we've all been through a lot with the pandemic and COVID, and the big wake-up call to, is dentistry really considered an essential service? Mm-hmm. And should we stay open? Should we shut down? Where do we fit into overall health? So, a lot of people are talking about the pandemic and the downside of it. I think this is one of the most glorious opportunities dentistry's ever had, because we are now appreciated and revered as a part of healthcare like never before. Meaning the oral health is the gateway to the overall body, and not in relationship necessarily to COVID. I'm talking about overall health. And here in Canada, when dentistry shut down for 3-4 months, patients were in dire issue. There's dire issues. Sure. And I think the general patient missed dentistry more than we ever thought that they would. So I think the timing's a lot. The top 10 things that have kept North American dentists up at night actually hasn't really changed that much. Probably, which is why we're still here helping build and grow dental practices and help dentists. But I think a big part of the challenges now, the biggest things we hear now that we're sort of coming out of this. Now, remember, I live in a place where we basically locked our house for 15 months. I mean, it comes and goes a little bit. Well, I watch all my American friends have parties and get to hug. We're still quite isolated. But I think dentistry overall, looking at the pandemic and saying, what can we take the best of? change the rest. Dentistry was forced to change in an alarming pace without it being part of their choice or control. And I'm a change agent by nature. Our whole company is about how do you have a better future than your past, and to do that, you have to change something.
Right.
So it was interesting to watch, but I think now that dentistry's kind of gotten used to all these changes, there's a lot that they had to do to deal with treating patients to deal with continuing to operate in a pandemic. I think now what I hear is the biggest thing, and I just had a morning call with all my coaches, is human resources, culture, and team morale. It's been labeled COVID fatigue, or people are just really exhausted with what they've been through. But I think, dental practices that had their foot on the gas before the pandemic happened, they've come out and rebuilt. And the clients in our family are exceeding pre-COVID production. There's no question.
Yeah.
And now that the catch-up's over with, there was catch-up that was there. I
Sure.
often say, is this lost production in dentistry or is it delayed production? So I think it's a little of both. Okay. But
Yep.
the people, dentistry is a human capital business, and 80% of everything we do is the ability to meet human needs emotionally through the health of our auxiliary and our teams, and the leadership culture in combination with the patient relationship. So I think we've been hearing that a lot. There's leaders are needing to kind of get creative, step up. There hasn't been able to be team meetings. Teams haven't been able to do their regular morning huddle, which is one of the most critical systems in the dental practice because of different social distancing and things happening. So I think you put the people first in dentistry, the great thing is the money comes. So I think if we reinvest back in the team, because the team is then the one that needs to keep their energy high for the patient experience. And there's been, so many patients that have fallen out of care through this pandemic that need to be reattached to the practice and scheduled. And to do that, they have a lot of choice now. They have a lot of choice, and they become a lot more savvy into infection control, which dentistry was always good at. I said when this started, if I was going to have surgery, I'd have it in a dental operatory, as one of the most sterile places on earth. Dentistry's done a good job with that.
Sure.
What COVID did is took probably the people under the radar not seeing value in that and made them comply. They had no choice. But
Right.
I think patients now it's the first thing is the team, the morale, and getting back engaged in this is not going to be talking about COVID forever.
Right.
Right? We treat everyone like they have COVID. So it's how do we how do we re-energize the workplace, reignite it? And that comes from the leader. It also comes from the management model. Because the
Right.
second thing we're hearing a lot of is like practices have office managers, but the distinction between is that a title or is that an actual skilled role they've had training in? Because all these changes took some significant leadership and management for the larger practices to coordinate everything. So we're
Sure.
doing a lot of work right now with some virtual office manager training, and a lot of office managers realizing I think there's skills that I need, and how to influence better, how to be more assertive, and how to actually be a true manager.
Yep.
Right?
Good point.
A manager isn't someone who sits in the reception area and talks to patients all day and does scheduling. A manager needs to come up. I call the manager, the peanut butter in the sandwich between the owner and the patient acceptance.
Yeah.
And how is that working? I think
Sure.
the third biggest challenge, because I'm queen of threes, the third biggest challenge is how do we work on our telephone techniques, our communication to our patients for their confidence, and reiterating our safety and how the dental practice is something that's critical to them continuing with,
Right.
regardless of what's going on in their life. So patient retention is the lifeblood of a dental practice. 80% of every dentist schedule in 4 to 6 weeks comes from patients of record through hygiene exams in previously diagnosed dentistry and newly diagnosed dentistry. So, when dentists say, wow, this pandemic, I don't have to go check hygiene, I go, hold on. I know none of you like hygiene exams because they interrupt your procedures, but we've got to find a way for our diagnostic opportunities to remain the same.
Sure. Sure. So, you know what, Lisa, I want to ask you about. You talked about three things here, and the last one that you mentioned was the phone. How do we communicate? How do we talk with our patients? I want to jump in and I want to dive into this a little bit more. And
Sure.
as you know, we run a really fast show here. Give me a couple of things that, and let me actually back up a little bit. I think we overlook some of the simple things of getting some of the simple things right on the phone. What do you think are a couple, two, three things that practice can do on the phone right now today that'll make a significant impact in their practice?
Well, I mean, one thing, as simple or as remedial as this sounds, is the toughest thing about a telephone is you only have your 10% words and your 30% tone of voice. You've
Mhm.
lost all the physical, the body language, and that's 60% of the connection in a relationship. So putting a mirror beside your telephone, it's been taught in customer service forever. This is not a new concept, but it's very, when administrators say to me, like, I'm a broken record, I'm explaining what we've done to close the rooms in fallow time like 1,000 times. I go, and you're going to keep doing it 1,000 more. And the challenge is, how do you keep your tone of voice, your words simple,
Sure.
and your tone of voice at a high level of energy, because that can be contagious. And one of the
Yep.
ways to do that is, it's impossible to be miserable in your tone of voice if you're looking at your face smiling with a positive facial expression.
Sure. Yep.
I mean, it's like I said, sometimes we just go back to the basics, because
That's
the burnout and the repetitiveness of saying it over and over, it can suck energy.
sure.
Another really important thing is, every human being wants to know that you know them and that you at least know their name. And it's amazing when we do call recording, or we work with a company that does call tracking, where why new patients don't show up is because of the first 6 minutes in the new patient telephone call, if they even do that.
Yep.
And I think a big part of it is, never treat a stranger, no matter what level you're speaking to them, and always treat the person, get to know the human first before you start talking about your schedule, your protocols, your policies. And please don't cancel last minute, because it causes me stress, right?
Right.
So there's some verbal skills and some scripting, absolutely, but
Sure.
words are a small part of this. If we keep it simple to them, it's really keeping the energy high, and how to not lose our momentum with, we do say the same thing over and over.
Yep. Yeah. I've never, I talking about, no shows, briefly, when that happens, what I think is that we talked them out of the appointment. They called, they intended on making an appointment, they intended on showing up, they intended on paying, and we told them not to. Somewhere we said, hey, please don't do that, do something else. And that's what they did. So what do you think about
You're
that?
right. We use the dreaded reply, okay, and it's not okay.
Yeah.
When someone says, I'm calling when they don't show with disrespect, blatant disrespect for our time, that's a bit of a different issue. But a big thing is, when they're calling to change their reserved time, it's not okay.
Yeah.
And a lot of patients now are using, due to COVID, as an excuse to cancel. And that's tough for administrators to get through, because, there's a lot of stages that we've been through, of fear, how do we deal with things. But I think it's not okay to cancel. And, basically not saying, if you just erased okay and came back with, using your power of silence for them to let you know what their real reason is, not interrupting them, but also to say, how can I support you in honoring your visit today that was scheduled, because we're committed to your oral health. There's lots of different things you can do, but not saying okay when someone's calling to cancel you and you say okay, it's not okay. It
Yeah.
gives them a false sense of, let's just keep doing this. That
Sure.
which is rewarded is repeated in human nature, right?
Yep. Good point. Give us one more phone tip.
Another phone tip is making sure that you don't let patients. Remember, we've got a new realm of emailing and texting. So the days of telephone harassment, dial a number, trying to confirm 80 people for a week, right? That's changed a lot. But I think the key is getting the verbal connection with speaking is not as common as it used to be. And
Right.
when you get that opportunity, is take that opportunity to truly build some rapport so that the patient feels that you care about them. And, we can talk about how to answer the phone and all those different things. But the reality is, humans are craving human contact in some way right now.
Absolutely.
Maximize that. Take advantage of it. Like even my medical doctor who used to do 3-minute physicals did a 2.5 hour, and I was laughing. And she goes, "It's just so nice to have a human."
Right. Yeah.
I went, "Wow.
Yeah.
If you did 2 physicals a day, we'd probably all be much better serviced," right?
Right.
But I
Yeah,
think
that's a good point.
maximize it, because it's what humans are missing right now, is
Yep.
the
Yep.
interaction, especially verbally. So when they call, look at that as a gift, because it's a
Yep.
lot easier to activate than it is on sending them a word message through texting or email.
It's great advice.
Oh,
Lisa, I want to thank you very much for coming here. I want to encourage our audience to check out your website, tgnapracticemanagement.com. A ton of information on there. Learn more about Lisa, and feel free certainly to reach out to Lisa and her team anytime. Lisa, grateful to have you here. Thanks so much. Wonderful information.
thank you. And I also will mention we do have Tuesdays with Transitions for that people to sign up for, that has an article library of hundreds of tips and solutions. So someone that might not want to necessarily love to talk to thousands of dentists every month, but there are other resources there. And as leaders, there you don't want to create things yourself. That takes a lot of energy. There's lots of things there for management, leadership, and tips of how to make dentistry a great place to be, because there's nowhere to go but up.
Yep. It's awesome. Thank you so much, Lisa. We appreciate it.
Thank you for your time.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.